I'm going to do a review and an overview of the PrEP rollout situation in Europe, the current update. I'm not going to get into detail because after that we have a roundtable and with representatives of different countries, and they will explain to us much more in detail. But well, these are my disclosures. I have some disclosures, as you can see, but there's still room for more disclosures, so also open to new proposals. Well, this is a slide is supposed to be the most updated. It's from the ECDC data. It's in September. It's just, sorry, this is just before to start with the PrEP. I would like to review some epidemiology in Europe and Central Asia. As you can see, in Europe, in the WHO European region, in 2017 there were around 160,000 HIV infections, and as you can see, most of them were in the East Europe, with 80% of the total of infections diagnosed in East Europe, and the less whereas in West and Central Europe the incidence was much lower, as you can see. And if we look at the transmission ways, and West Europe, you see that more than 50% are among MSM, and in the Central Europe, around 50%, whereas in the East Europe, the main route of transmission is the heterosexual. But I think that there is underreported MSM transmission because of stigma and homophobia. So probably this data is not very accurate. And interestingly, also you see that in West Europe, almost 50% of these infections diagnosed in 2017 were among people from abroad, born abroad of Europe. Whereas in the Central and East Europe, this proportion is much, much lower. In this graph, you see the different groups of transmission, different ways of transmission. The MSM, as you can see, it's the highest, has the highest incidence, although in the last years we've seen a decline in this incidence. If we look at different Western European countries, also we observe this decrease of incidence among MSM. I wonder whether the PrEP has started to play a role in this decrease of incidence. Maybe later, when we look at different experiences in different countries, maybe we can discuss about that. Huh? And now let's talk about PrEP, about the data we have on PrEP. This is an important source of information, is the Dublin Declaration monitoring, and it's information related to PrEP is collected by the ECDC. And according to this information, and this is the most updated data we have on PrEP in Europe. In this map, you can see that in the green, the darkest green color, are the countries where PrEP is available through the national health system or when the PrEP is reimbursed, and like in Norway or France or Scotland or Iceland and Portugal. And in the lighter green, you see countries where there are some implementation or demonstration projects or some research. That means that people can access to PrEP by participating in a study, in a demonstration study, on a clinical trial. And also you can see in red the countries where PrEP is not formally implemented. And if we look at the primary settings for the provision of PrEP, we see that there are different options, but in blue one, you see that most of the PrEP provision is implemented or is made in the infectious disease clinics. but also settings like the private providers or research settings or sexual health clinics also can provide this PrEP in different across Europe. If we look at the estimated numbers of people receiving PrEP in the last 12 months per 100,000 population in 2018, so last year, we see that the country where more proportion of people are on PrEP is Iceland, and then followed by Norway, Netherlands, Switzerland, Luxembourg, as you can see in this table, in this graph. When the ECDC asks for the main barriers for implementing PrEP in the country, they are asked to health providers, policymakers, and what they say is the cost of the drug, of the cost of services is the main barrier for us for implementing PrEP, and also the lack of technical capacity. Regarding cost, we look at the cost of the drug. There is a very wide range of prices of the drug, ranging from 150 euros to 3.25 euros, which is a big difference. On average, the median of the cost is 176 euros, as you see. But there is a there are very important differences on that. Even I guess that the generic, as Don commented before, generic drugs are becoming more and more cheaper, whereas the branded drug is still much more expensive. We have more information, not only from the ECDC, but we have this information from the European MSM Internet Survey. This is the second edition of the survey. It was implemented in 2017, and it's a very large survey. The participants, as you can see, are more than 127,000, and it's a very participating all these countries you can see in the map. And from this study, we can get very, very interesting and useful information. And the first information we can draw from this study is the estimated percentage of population, in this case MSM, because this survey is implemented among MSM. So you can see in the green, the dark green, that there are the countries where more people are on PrEP. You can see France and the United Kingdom and Iceland. And when we look at these countries, country by country, you can see that among MSM, the country where more people are on PrEP is the United Kingdom, with almost more than 100% of MSM are currently taking PrEP. And you can see at the tail of this graph the countries where the PrEP implementation is very low. Yeah? When we ask, or when they ask to MSM whether they would take PrEP if it was available and affordable, and they say that 44% said yes, I would like, and probably I would be on PrEP. But so it's clear that there is an interest at the community, but still a lot of community education should be done. We have information also from another survey. It's not so large, but it's still large. That's the Hornet study. This is a sponsor implemented by ECDC. And when they look at the PrEP users, this is the number of participants. It's more than 12,000 participants from 55 countries from Europe and Central Asia. So it's also, you say that a very representative study survey. And when they ask, are you taking PrEP? 10% of the respondents declared that they were taking PrEP, and 90% not. In this case, the respondents were more than 10,000 people. Also, but it was the same as in the first edition of this study, which was in 2016. It surprised a little bit that there hasn't been an increase in these 2 years, and then later we can discuss about that. And when we ask where they get the PrEP, you can see that they get PrEP from physicians only in 34%. But in more than 50%, they get the PrEP informally, or buying the drug online, or sometimes they go. We know that people go to the hospital or to an HIV unit asking for PEP, saying that he's been exposed, but they don't use the drug for PEP, for post-exposure prophylaxis, but for PrEP, especially if they do PrEP on demand, so they can have drug enough for several months. No? And we know that this exists, no? And other ways of getting the drug. No? And when they ask whether the health providers know, the doctors know whether they are on PrEP, as you can see, 34% don't know that they are on PrEP. That means they do the informal PrEP, they take PrEP, they take the drug without any kind of control, probably. And also similar to 2016. When we look at the indication for PrEP, like people who's doing post-exposure prophylaxis or has STIs or doing chemsex, then when they ask to people, have you taken PrEP in post-exposure prophylaxis in the last 2 months? Among not on PrEP, only 5% had PrEP in the last 12 months, whereas among those on PrEP, more than 40%, 45%, had been on PrEP in the last 12 months, which means that really the people at higher risk is those who are taking more and more PrEP. When we look at the STIs, we've been talking about STIs, and they were asked whether they had been diagnosed of any STIs in the last 12 months, and among those not on PrEP, 69% said no, whereas among on PrEP, 87% had been diagnosed of any STI in the last 12 months. Also, an important difference, a significant difference in these groups, which means that also people on PrEP were more at risk. Yeah? And we look at the drugs, at the consumer of drugs, chemsex, when they were asked whether they had been using or taken GHB or ketamine or crystal meth during the last 3 months, among not on PrEP, 5% said that they were doing chemsex, but among those on PrEP, much more, as you can see, an important difference in this group of people. So again, that people was identified as having more risk for an HIV infection. No? So the distribution of the HIV diagnosis in Europe are diverse across the countries, and in several Western and European countries we are observing decline in HIV new infections, especially among native MSM and some heterosexual men and women. We would like to know whether this decrease is attributable to the PrEP. I'm sure that yes, and also because of the test and treat strategy. I think that these are the main causes of this decrease, and I'm sure that we can discuss later on the discussion table. And also, we know that the formal PrEP rollout has been slow, especially in Eastern and and parts of Europe and Central Asia. And as a result of this slow development of PrEP, we see that quite significant amount of a proportion of people are starting or taking what we call the informal PrEP. So they buy the drug and they do sometimes some follow-up or not. Later also I'll show you some experiences on that. And also we see that this group of people doing this informal PrEP very often don't have any kind of information, or they don't have an adequate follow-up for that. Also, we see that the service deliveries or delivery models for PrEP provision are different across different European countries. I'd like to knowledge to Taimur Nori from the ECDC, because he allowed me to share these slides. As you can see, most of this information comes from the ECDC. And I thought that it would be better to shorten my presentation in order to be able to also to have more time for to present the experiences from different countries. I don't know if there is any question, or we can go to the next presentation. Thank you. Thank you very much.